Aaron, if you could bend your right knee so that you push it down. We'll say that she can't do that on the left without assistance. So instead of going underneath the leg, what I'm going to do is, again, I'm going to my web space. I'm going to go right around her. Yeah, I was going to say, can you guys, if I go here, I'll be blocking it. So, all right, we'll pretend her leg is in, but, so this hand I'm going to be doing, my web space is right underneath her patella, and my left hand is right above her malleoli. You don't want to be right around it because that's uncomfortable. And then what I'm going to ask her to do, I'm almost giving her like an approximation cue. I want to say, I want you to bring your knee up toward the ceiling. So you're kind of cueing her to use her hip flexors and assist you with getting that leg into position. So as opposed to underneath, you're on top, just like this. Okay, so then once you get her there, then then I can say this leg was probably already up. So already go ahead and bend that knee. Great. So now she has both knees bent. Her weight is on her feet. So now depending how much assistance she needs, and we talked about the benefits of bridging, as far as how we can do it, it depends on where your patient is. So if you're in acute care and the patient's in the bed, I would stay right at the side of the bed, raise or lower it to an appropriate height for you so you're using good body mechanics. If you are in the rehab gym, where I am, I would be right up on top of the mat with the patient. So I'll show you both ways and then you can play around with both ways. So we'll say the first time at the bedside. So we'll say that she is able to control this lower extremity, but not so much on this side. And now I'm going to ask her to actually bridge. So what I can do is use my leg to block her foot. A lot of times the patients either have nothing on their feet or in socks, and they're on those like plasticky air mattress things, so their feet can slide right out. So I can block her foot here if I need to. And then depending on how much assistance she needs, we'll say she only needs assistance on the left for now. What I'm going to do is, what muscle group is going to extend the hip? Glutes. So obviously I need to have one hand on glutes to be able to facilitate that hip extension. And the other hand is going to be up here to give a cue. Again, we're going to try and cue her down into her feet so that she lifts her hips. So one hand on glutes, and what I'm going to say is, Erin, I want you to try and lift your hips up towards the ceiling. And you see how I'm just doing a weight shift. You don't want to be like trying to pick her up as part of the bridge. So you can see my weight is here, and then I'm shifting my weight as she lifts up. And again, all I'm doing here is increasing the tension in my hands through glutes to tell her, glutes, you need to work to lift these hips up. Usually what you're going to see is like an asymmetrical bridge. She's obviously stronger on this side, so she kind of comes up on an angle. So that's why I want to be here and here to help her on this side. Bring it back down. If you needed to help with both, and let's say now you're in the clinic and you're on the mat, I always differentiate those because if the patient's in bed, usually you don't want to jump into the bed with them for these reasons. So, in the clinic, in the rehab gym, obviously you can be in this position. So now I'm using just the position of my body, my legs to block her feet from shooting out. And now I can be here and here. So go ahead and lift up. And again, now you can see how I'm just kind of shifting back to sit on my heels. So that's my weight shift. If she needed help with both sides, what you can do is kind of use everything you have. I'm going to be here and here. This is as I shift my weight, that's what's going to give her the cue at her distal femurs, and then I'm going to be here on both glutes. So we'll say she needs a little more help. So Erin, I want you to lift your hips up and down. So I'm giving that same downward cue into her feet, and then I'm assisting with my hands at glutes, try and lift her up. Okay. Now I mentioned you can also, these are narrow, so just be careful when you practice this, but I mentioned you can also use bridging to help her reposition herself. So I'm just going to cheat and have you move all the way towards me so that you have a little bit of room. Okay. So if I wanted Erin to move over to the right in bed, again, I don't want to do something passive or use a draw sheet and just pull her over to the edge of the bed. I want her to help me if possible. So what we can do from this bridge position, again, remember how we talked before, we talked about the position of the heels when we were doing like a scoot or a squat pivot transfer. Same thing applies for the bridging. So what you can do is if you want her to go that way, you're going to bias your heels a little bit that way. Okay, and then I'm going to help her with the bridge. So what I want you to do, Erin, is pick up your hips and move them a little bit to the right. Okay? Now, again, instead of just going in and actually, and I would be on this side. That's the other thing. You're not going to be able to see. Let's try it. Okay. So I'm here. No, you're okay. So she already scooted her lower body. If I want her to scoot her upper body, again, if If you don't have somebody to help you and she has no control over her lower extremities, you're going to have to give up the lower extremity position. I'll move her upper body and then I'll have to go back and get her into a bridge again. But assuming she can hold this position, instead of grabbing her under the shoulders and just pulling her towards me, which will get her in the same position, what I'm going to do is use that clavicle cue that we've used in the past, and I'm going to try and get her to lift her, tuck her chin to her chest so that she's lifting her head and shoulders, using her abdominals and her neck flexors to try and unweight her head and shoulders and move them towards me. So again, do not grab them around the neck. Doesn't work that well. So I'm underneath her clavicles. And Aaron, what I want you to do is tuck your chin to your chest, lift your head and shoulders, move them towards me. So I'm trying to give her a downward cue underneath her clavicles to get her abs active and to move her over. And then if you need to do it again, you can move her. Actually, this one should be able to move. So again, you want to only move what you need to. And Aaron, what I want you to do is lift up your hips and move them towards me. And that's about as far as we can go. So if you, and we've tried it in the past where we did 2 tables together, but that split in the middle always makes me a little nervous. So just be very careful when you practice. And you can go ahead and go back to the middle. Okay, and you can also give like a little directional cue, like what we were just doing to try and get her. So if you need to help her, provide her direction, if she's got her heels pointed this way, as she lifts up, I can just help to guide her over in that direction. Come on back. Just to back up to using bridging from an impairment level, we talked about why it's great for co-contraction around the hip, great for isolating out the hip extensors. If she's getting better at it, how could you make it challenging for her to bridge and make sure she's using this side? One leg. So you can have her extend this leg and bring it down to the floor. Okay. And now even if she needed a little bit of help here, but I could still do and lift up. Now you can see what she's doing with that right leg. Right. She's honest. She's digging her heel down into the mat, so she's still using it a little bit. So if you really want to take it out of play, you could just relax your knee and put it and cross it over. Again, that's not a specific NDT technique, but if you want to challenge them, make the bridging more challenging, you can go to half bridging, and if she's still cheating, you can get her to get into this position. Again, assuming she doesn't have any other precautions that would preclude her from doing that.
What will happen with either bridging or half bridging, if the person has a fairly strong extensor synergy, the leg might not, it won't stay like Aaron's leg is now. So you may have to put your hand there to stop it from sliding out. Certainly if the person has their shoe on, if you use table paper, it can slide, not so much on the vinyl.
We did when I showed them initially, like if they were in acute, how they could use their lower extremity also. So whatever you need to prevent that from shooting out. But again, remember when we talked about the developmental sequence, when we talked about tall kneeling, and that was a great position for if they can get into that position for somebody who has a strong extensor pattern, you're putting one joint into flexion while the other is extended. So you're breaking up that synergy pattern. Same goes here. You're bringing the knee and the hip up into flexion, and then you're just asking for extension at the hip. So that's definitely a good activity to try. If you could stay here, we'll just do head mobility really quickly. I'm not going to spend too much time on this because I'm sure you guys have learned how to get people from sit to supine and back and forth. So I'm just going to show you some other ways that you can, some other things that you want to be careful of, and some other techniques. So just to talk a little bit about positioning from an NDT, well, from any perspective, the aims of positioning, obviously you want to provide support. You want to inhibit abnormal